Start with the PKPD modeling. What is PKPD modeling and the role of the PKPD modeling in pharmacology? So here we can see the three terms. First, that is pharmacokinetics, PK. We all know that is in pharmacokinetics, this is the movement of the drugs inside the body. Second term is the pharmacodynamics, that is the effect of the drug inside the body. And third term here is modeling. What is modeling? Here we assume the different body organs as a different compartments. So the inclusion of the mathematics in the pharmacology is the whole PKPD modeling. So let's take one by one. First is PK model. If we plot the graph for the PK model, the graph is between the concentration and time. And we all know the drug concentration is first increases and decreases with the time. If we take the PD model, pharmacodynamics, and make a graph for the PD model, so that is PD pharmacodynamics is mainly effect of the drug. So graph is between the effect and concentration. So with the concentration, first the effect of the drug is increased, then it will be decreased. Next, if we combine both models, PKPD model, and we plot a graph for the PKPD model, so we will find the graph between effect of the drug and time. The effect of the drug is increased with time, then it comes to plateau with the saturation of all receptors. So in the PK, we all know that is the movement of the drug, and here is four phases. First is absorption, then distribution, then metabolism, then excretion. So if we give the IV bolus to the patient, means directly drug inserted into the blood, and we assume that the blood is the central compartment. So here the phase which is absent is absorption. In the pharmacokinetics, there are four phases. One is absorption, then distribution, then metabolism, and excretion. So if we give the IV bolus means directly into the blood, and blood is our central compartment, so the phase that is absent here is the absorption. So the drug will get distributed, metabolized, and excreted from the body. So for better understanding of the PKPD model, we must know some parameters. First is that is dose in milligram or gram. So dose is the amount that is given from outside the body, amount of the drug that is given from outside the body. Second is actual amount or the amount. This is the actual drug which is present inside the body. Third is the concentration. Concentration is, we can easily find out by dividing the amount by volume. Fourth is volume of distribution, the most common or most important parameter in the pharmacokinetics. Volume of distribution is equal to amount divided by concentration. So these four parameters we have to know. There are some mathematical formulas that we have to know. Or we can say mathematical equations. First is volume of distribution. As we already discussed, volume of distribution is equal to amount by concentration or plasma concentration. Second is clearance. And we can calculate clearance by rate of elimination divided by plasma concentration. Third is half-life. So we already know the formula of half-life. T half is equal to 0.693 by rate of elimination or constant. So all these three formulas are important for the PK model. Some other formulas or the formula for the PD model. Pharmacodynamics is mainly the effect of the drug. So the formula is E equal to E max into concentration by EC50 plus concentration. So here the E is equal to E means effect. Second is E max, the maximum effect. C is the concentration of the drug, and EC 50, concentration at 50% effect. Now let's discuss the fundamental concept of the PKPD modeling. What are the fundamental concepts for PKPD modeling? The most important thing is the plasma concentration, that is equal to amount divided by volume. We already discussed why we have to know the plasma concentration, because this is very easy to measure from the blood sample. If we take the blood sample, suppose 1 ml blood sample, so we can easily measure the plasma concentration by calculating the amount and volume of the drug. So from this formula we can easily find out the volume of distribution, that is amount upon plasma concentration. Here volume of distribution is the volume of the drug that is distributed evenly in the blood. So we calculated here the volume of the drug, and that is the most important parameter for the PKPD model. In the most common scenario, we can see if the drug is distributed only in the central compartment, like in the blood. If we give the IV drug and drug is only distributed in the central compartment, so we can say that volume of distribution of the drug is equal to the volume of blood, because drug is only in the blood in the central compartment. But this scenario is very rare, because distribution is larger than the blood, because drug chemically bound in other parts of the body that cannot be measured. Drug is towards the receptors, so its amount cannot be measured. So always the volume of distribution is always greater than the volume of blood. Another central issue is rate of elimination. That is important, rate of elimination. And we all know that the drug is eliminating from the body by first order kinetics and zero order kinetics. So the formula we can take, the clearance is equal to rate of elimination by plasma concentration. So we can say that the rate of elimination equal to plasma concentration into clearance, or we can say rate of elimination we can write as amount upon volume. Amount is the drug given outside from the body, and volume and clearance. So here we can see the rate of elimination is proportional to amount, or the remaining amount of the drug inside the body. So we can say rate of elimination equal to clearance upon volume. We take the clearance here and the remaining amount. So this we can take as the proportionality constant. And sometimes this is referred as the micro constant. And we can replace it with the macro constant, that is Ke. This is macro constant. So this is very important for calculation. Elimination constant for the elimination, and second is absorption constant. If the drug is absorbed and then go to the central compartment, if the patient takes the drug orally, drug first get absorbed and then go to the central compartment. So in some situations clearance and volume cannot be separated. In that situation we will consider the elimination constant for estimation or calculation. So in the PKPD model we assume that the body organs at a different compartment. So let's take the compartment models. Suppose there is single compartment, mainly is the blood. If the drug is directly given into the blood, this is the central compartment, and this is known as the single compartment model. Single compartment model. Drug is given IV. Second scenario is if patients take the drug orally and the drug first get into the GI tract. After that the drug is absorbed and go into the central compartment. So here we have to attach another compartment with the central compartment, that is GI compartment. So, but this is not called as the two compartment model, because linearity is maintained and the drug is only eliminated from the body from the central compartment. The drug is not going back to the GIT tract. So this is called as the additional compartment, but not called as the two compartment model. So here we can see elimination constant and absorption constant. We can call as the central compartment and additional GI compartment. Third scenario, if there are two compartments. some highly vascular compartment like the blood central compartment and addition of some other compartments or other body organs. So suppose the drug is give to the central compartment in the IV form. So this compartment we can call as the C1 and the other compartment we can call as the C2. So the first compartment or the central compartment in C1, the drug goes from the central compartment to the peripheral compartment or organ. After the action of the drug again comes to the central compartment for the elimination. So here we can see elimination constant from compartment 1 to 2 and the elimination constant from compartment 2 to 1. Like that, there is three compartment model. Three compartment model. Here, two compartments we can attach to the central compartment. Some highly vascular compartments and less vascular compartment. So first the IV drug comes to the central compartment, and from the central compartment goes to the peripheral first compartment, and then second compartment, and from both compartments drug back to the central compartment. So we can call it as C1 central compartment. This is C2 peripheral compartment, and another peripheral compartment known as the C3. So here the elimination constant from 1 to 3, here from 3 to 1, here the elimination constant from 1 to 2, and here the elimination constant from 2 to 1. Like that, there are many multiple compartment, and the most realistic stage is the multi-compartment model. So these are the compartment in which the drug is passed on. So for better understanding, we have to know the T half. What is T half? Time taken for the plasma concentration of a drug fall by 50%, and the formula of T half is 0.693 upon elimination constant. This is the formula. But there are two phases in the T half, alpha phase and beta phase. Because suppose we give the drug in the central compartment. This is the central compartment, and we give the IV drug, IV bolus in the central compartment. First drug goes in the central compartment, and then the distribution phase will start, and drugs will go to the other compartments. Right? Now the drug is not here in the central compartment. After sometimes drug fulfill their action and come again to the central compartment, and then eliminated from the body. So elimination phase is going on with the distribution phase, and after that the total elimination phase. So there are two phases. First is alpha phase, we can call as distribution phase. Second is beta phase, that is elimination phase. So if we plot a graph for the pharmacokinetics between the plasma concentration and time, so we will see a deep fall, then plateau, because this is the alpha phase, and in this phase the drug is distributed in the different compartment and eliminated also. So the drug concentration is fall very quickly. Now there is beta phase. Now the all drug from the peripheral compartment into the central compartment, and the drug is mainly eliminated from the body. So there is no deep curve here. The drug is slowly eliminated from the body, mainly eliminated. And this graph is between the time and plasma concentration. So if this we can say as the one compartment model, single compartment is there, first drug is distributed and then eliminated. If there is two compartment model, so here we can see for the one compartment model the graph is like this. For the two compartment model, the more deeper graph, because the more drug is distributed to the different organs, so the less amount of drug in the central compartment, so the graph of the two compartment model will be more deep. This is graph for the two compartment model, and this graph is for the one compartment model. So like that, if there is three compartment model, the graph will be more deeper. If multiple compartment model, the graph will be more deeper. So let's take one by one. First is single compartment model. How we can calculate the numericals? Single compartment model. So drug, if you give the IV drug and it's follow the first order kinetics, means the fraction of the drug that is eliminated from the body is constant. So let's take the differential equation for the first order kinetic. dA by dt. What is dA by dt? That is the rate of change of drug amount in the body over time. Rate of change of drug amount in the body over time. And this is equal to clearance and plasma concentration. So we can write negative sign is for that the drug is eliminated from the body. Negative sign shows that the drug is eliminated from the body, and dA by dt is the rate of change of drug amount in the body over time. So we can write this concentration as amount upon volume, and we can write dA by dt is equal to clearance upon volume, that is elimination constant, and the remaining amount. So we can write as dA by dt equal to elimination constant to remaining amount. So this is the single compartment model, means the all amount of the drug present in the single compartment. So we can write the amount as the concentration. So we can write the formula for the amount A at time t, amount at time t, equal to initial amount rate of elimination into time. And we can write the formula for the concentration as it is. Concentration at t time is equal to initial concentration into rate of elimination in respect to time. So this is the main formula that we can calculate the number of numerical for the central compartment or the single compartment model. So suppose there is a numerical. Let's solve a numerical. Suppose a dose of a drug is 100 milligram per volume, and the volume of distribution is 10 liter. Clearance is 2 liter per hour. So after 5 hours, how much drug will be eliminated? How much drug will be eliminated from the body? So let's calculate. What is our formula? Main formula is C at t time initial concentration into elimination constant. So let's calculate the plasma concentration first. Plasma concentration we can calculate by amount by volume, or we can say dose by volume, because the amount is given from the outside. So the plasma concentration is dose by volume, 100 by 10, that is 10 milligram per liter. Now the elimination constant we know, that is clearance by volume of distribution. Clearance is 2. 2 is the clearance, and volume of distribution is 10. So we can write here 2 by 10, and the answer is 0.2 hours. Now how we can calculate in the formula? So remember, small e is known as Euler's number. So small e equal to, that is the Euler's number, and small e equal to 2.718. 2.718. So we can find 2.718, that is approximately 0.3679. So let's take the formula. After 5 hours, concentration at t time is equal to initial concentration to elimination constant. So concentration at 5 hours is equal to initial concentration, that is C0, we already calculated, that is 10, and E, the value of E is 0.3679. So the value of K and T already calculated. T is 5, means 5 hours, and the K value is 0.2. 10 into E, 0.2 into 5. So concentration at 5 hours, 10 into 0.3679, because this is equal to 1. So the final concentration at 5 hours is 3.7 milligram per liter. This is the final concentration for the single compartment model. So this is for the single compartment model. Like that, there are multiple compartment models. Let's take the 2-compartment model. Let's first discuss the advantages of the single compartment model. What are the advantages? We can say that is easy to calculate. Calculations are easy for the single compartment model, and that is the most simplified model, and it follows the first order kinetics. and we can easily apply. Disadvantages of the single compartment model: that model is not realistic because drug is always not confined to the central compartment. Most commonly drug is cross the membranes and goes to the other compartment as well. So not realistic model. And the narrow escape applications we cannot use everywhere. Where we can use, mainly we can use this model for the pharmacokinetics of some antibiotics and analgesics. Now let's take another model, that is addition of the another compartment to the central compartment, means the GI compartment, if the patient takes the drug orally. So we already discussed in this case the extravascular dosing and one compartment attached to the central compartment, that is GI compartment. Suppose this is the central compartment and this is the GI compartment. So first drug will go into the GI compartment, then come to the central compartment and then gets eliminated. So this GI compartment we can call as C2 and this is the central compartment. So drug first get absorbs with the absorption constant and that get eliminated from the body. Mainly the absorption constant is more than the elimination constant in most of the cases. This absorption constant is more than the elimination constant. Sometimes this absorption constant is less than the elimination constant. Sometimes this absorption constant is less than the elimination constant, and this condition is known as the flip-flop situation. Flip-flop situation. That condition is known as the flip-flop situation. So with the addition of the extra GI compartment to the central compartment means there is the inclusion of the bioavailability, how much the drug gets into the central compartment. And we know the volume of distribution formula with the bioavailability is the volume of distribution is equal to bioavailability into dose by plasma concentration. So we can find out the bioavailability, that is volume of distribution into plasma concentration by dose. So the concentration, plasma concentration here is bioavailability into dose by volume. And we know the formula for the single compartment model. That formula was concentration at T time is equal to initial concentration into elimination constant. With the inclusion of the bioavailability in the formula, we can write the another formula for the additional compartment to the central compartment, that is GI compartment, and the formula will be concentration at T time is equal to bioavailability into dose, absorption constant divided by volume, absorption constant that is mainly higher than the elimination constant into elimination constant minus absorption constant. And this is the formula for the additional compartment and for the oral drugs for the plasma concentration at time t. This is the formula. So this is single compartment with the additional compartment, that is GI compartment. We can write the formula with the inclusion of the bioavailability. Now the formula or the calculation methods for the two compartment model. Formula for the two compartment model means there is another compartment that is attached to the central compartment. Drug goes from the central compartment to another compartment, then comes after the reaction to the central compartment. So two elimination constants are here from compartment 1 to 2 and compartment 2 to 1. This is the central compartment and this is the peripheral compartment. So there is two phases of distribution or the T half. First is alpha phase and the beta phase will be there. First drug get distributed, then get eliminated. So we can include, we all remember the formula for the single compartment model, that is concentration at T is equal to initial concentration with the elimination constant. Here two compartments are there, so we can include the two compartments A and B. and like two elimination constant we can replace with A and B. This is the formula for the two compartment models. Here A and B are concentration intercepts. Concentration intercepts. So what are the characteristics of this two compartment model? This is somehow more realistic than the single compartment model. So let's take the advantages of this double compartment model. What can be the advantages? This is the calculation will be more accurate and in comparison to the single compartment model. More accurate model. And widely applied model. This is widely applied model for many drugs in comparison to the single compartment model. So what can be the disadvantages of this model? The complexity will increase. More complex model, of course. High data required for this model. And the calculation are more difficult in comparison to the single compartment model. So what drugs we can use for this model, or for which what drugs we can use this model? Some antiviral drugs, anti-tumor drugs, and some other long-acting drugs. Now let's take the three compartment model. Means the two extra compartment will attach to the central compartment. Drug goes from central compartment to the other compartment, and from the peripheral compartment to the central compartments. So here we can see central compartment, one peripheral compartment, and second peripheral compartment. Elimination constant from 1 to 2, 1 to 3, elimination constant from 1 to 2, elimination constant from 2 to 1, elimination constant from 3 to 1. So we all know the graph between the concentration and time will be more deeper because here are two extra compartment that is attached to the central compartment. So let's take the formula for this. So we can easily write as concentration at T time is equal to A elimination constant, B compartment elimination constant, and C compartment with elimination constant. So here A, B, and C, that is concentration intercepts. A, B, and C is the concentration intercepts. So this is the three compartment model. Let's discuss what may be the advantages of the three compartment model and the disadvantages of the three compartment model. Here three compartment model, the accuracy will be high. We can get the more accurate result because this is more realistic model in comparison to the two compartment model and the single compartment model. And disadvantage, what will be the disadvantages? More and more large data required here. The model concentration and the parameter estimate are difficult here. The formation of the modeling or making the model that is more difficult in comparison to the single compartment or two compartment model. So this is the parameters for the pharmacokinetics. So we can calculate by these formulas for the single compartment model, double compartment model, and the three compartment models like this multiple compartment models. Let's take PD modeling. PD pharmacodynamics. Here mainly we calculate the or see the effect of the drug. So mainly drug molecule bind to the receptor on the cell surface. So we all know there are agonists which can activate the receptors, agonist which can activate the receptors, or there are some antagonist which can block the receptor. So the reversible binding can be written as drug with receptor attached to the receptor and make the drug receptor complex, binding constant, and reversible binding constant. So K1 here is rate constant for binding, and we can also call it as the association constant. K minus 1 is rate constant for unbinding, and we can call it as dissociation constant. This is rate constant for unbinding, and the affinity describes how strongly the receptor binds. So the affinity will be association constant divided by dissociation constant, that is equal to 1 by Kd. What is Kd? This Kd is dissociation constant, means the concentration of the drug at which 50% receptors are occupied. This is mainly dissociation constant, means concentration of the drug at which 50% receptors are occupied, and this is called, we can call this receptor theory. So by this we can say lower the dissociation constant is equal to higher affinity. Lower the dissociation constant is equal to higher affinity. Second is, what is Michaelis-Menten reaction? Michaelis-Menten equation for the maximum effect, or it can be called as the maximum effect model. And we all know the pharmacodynamics studies are mainly for the effect of the drug. Here we can plot a graph between the concentration and effect. So let's first define the dissociation constant. At equilibrium, the forward and reverse rates balance. They balance, means drug receptors association constant is equal to dissociation constant. So we can rearrange it to get the Kd, dissociation constant, means the concentration of the drug at which 50% receptors are occupied, that is Kd. So let's rearrange it. Rd divided by combination of Rd equal to dissociation association, that is equal to Kd, dissociation constant. So here we can find Kd equal to dissociation by association, and the unit is concentration here. Second thing, we can replace the free receptors with the total receptors. Replace receptors that are free, this is the symbol of free receptor, with total receptor, that is R total. So we can write R total equal to R plus free receptor plus occupied receptors. So we can write as free receptors equal to total receptors minus occupied receptors, and after plugging into the equilibrium reaction, plug this into what we can get. We all know dissociation constant equal to Rd by Rd. So we can write here Kd, the dissociation constant, equal to R total minus Rd into D by Rd, because we place in the place of R and we place D as it is. So up to here we find the dissociation constant, that is R total minus RD. Are bound. Solve the fraction of receptors that are bound. Fraction of receptors that are bound means RD upon R total. So start with KD and we can write as dissociation constant equal to D, same formula, R total minus RD by RD. We just take the D here. Now expand the brackets in the numerators. Expand the brackets. What we will get? Here we just expand the bracket, so D is on the both side upon RD, that is KD. So according to the algebra, we know A minus B upon C is equal to A upon C minus B upon C. So we can write as D R total upon RD minus D RD upon RD. A upon B, A upon A minus B upon C is equal to A upon C minus B upon C. So now we can cancel RD with RD. So we can write KD is equal to D R total upon RD minus D, or we can write as D R total upon RD is equal to KD plus D, if we put the D on another side with the KD. So now insert both sides. Let's take invert the both side. RD upon R total is equal to D upon D plus KD. D plus KT goes down. Now D is on the upside, and this is the formula. This is the fraction receptor occupy. This is the fraction of receptors that are occupied. Now link the occupancy with effect. Mainly we have to calculate the effect. So link occupancy with effect. Let's assume that the pharmacodynamic effect is directly proportional to the number of the bound receptors. So we can write effect is directly proportional to the number of the bound receptors. Here alpha is proportionality constant. So we can say that the maximum effect will be the occupancy of all receptors, total receptors. So we can write here E by E max is equal to bound receptor by total receptors, or E by E max is equal to, we can replace the RD by R total with the D by D plus KD. So we can write here D by D plus KD. So the final Michaelis-Menten reaction, or the Michaelis-Menten pharmacodynamic form is, we can write E is equal to E max D by D plus KD, and this is the final Michaelis-Menten reaction. In a special case, suppose D is equal to KD, means the drug is equal to dissociative constant. Suppose D is equal to KD, and suppose D is 50. So by putting in the formula, E is equal to E max into 50 upon 50 plus 50, that will be half. So we can easily say E is equal to half E max. So we can say if D is equal to KD, then the effect will be half of the maximum effect. So now we have to combine. Let's discuss a numerical. For the effect, suppose a drug follows the Michael-Menten reactions. A drug follows Michael-Menten reaction or the Michael-Menten relationship between concentration and effect, where Emax is equal to 100, dissociative constant is equal to 5. So calculate the effect of drug at given concentrations. Suppose the concentrations of the drug is 1 milligram per liter, 2 milligram per liter, and like that 3 milligram per liter. So we have to calculate the effect on all concentrations. So let's take solution, and we know the formula. E is equal to E max d upon kd plus d. So for the first condition, if the dose is 1 milligram, concentration is 1 milligram per liter, so the effect will be 100 into 1 by 5. Dissociative constant is 5 plus 1, that will be 16.7. At concentration of the drug is 2, so if the concentration sorry if the concentration of the drug is 5, so the effect will be 50. And if the concentration of the drug is 20, so the effect will be 80. So let's see drug concentration and effect. For condition 1, concentration was 5, 1, 5 and 20, and the effect on concentration 1, 16.7, 50 and 80. So here we can see the difference between the concentration and the difference between the effect. So we can easily say, even at the more concentration, the drug effect will get decreased due to the saturation of the receptors. And if we have to make a graph for the drug effect, so first the effect will be increases, and then the graph will be plateau because of the saturation of the receptors. Now combined both PKPD model, because our aim was calculation for the PKPD modeling and drug having both effect. Both properties are present in the drug, pharmacokinetics and dynamics. So here we have to combine both models. So for the pharmacokinetics, we know the formula: concentration at T time is equal to initial concentration with elimination constant. That was the formula. And for the PD modeling, effect of the drug is equal to Emax. This is formula for the PD model in respect to concentration and time. So if we want to calculate in respect to the concentration and time for the PKPD modeling, so the formula will be effect in respect to time is equal to Emax into concentration at time t upon EC50, that is concentration giving 50% of maximum effect plus concentration at T time. So this is formula for the PKPD model. If we want to calculate both PKPD properties of the drug, so we can use this formula for the calculation of the PKPD model. This is the simple combined equation, how the drug concentration decrease over time and how the effect changes accordingly. So this is all about the PKPD model. Thank you.